Got it. So a quick one just before we okay, we've got a live link now. People, I'm just going to share this with the registrants so that they can access the live stream. All right, I'm going to open the waiting room now. And then we can get started.
Good morning, everybody. Thank you for joining us this morning. We're just waiting for a few more people to join in. We had really significant interest in this, so we want to make sure that everybody who signed up is able to join. So we're going to wait for a couple of minutes before we start. Just to let you know, those who are already in the room, that we are live streaming on YouTube. You should see that on your screen, and I hope that you're comfortable with that. We'll do introductions in a second. Okay, so it's just after 10 o'clock. We said that we would start the session at 10. I will do introductions. I will introduce myself first. My name is Ntsiki Mpulo, Nontsikelelo Mpulo. I lead the communications team at Section 27, and I have my two colleagues here, and they will introduce themselves. We'll start with Julia.
Good morning, everybody. My name is Julia Chaskelson. Like Nsiki said, I work in the communications team at Section 27, and we're really excited to have this session today. And we're also really grateful to be joined by a healthcare worker himself. His name is Dr. James Van Duuren. So let me pass over to James and you can introduce yourself.
Thanks, Julia. Hi, everyone. As Julia said, I'm James Van Duuren. I'm a junior doctor working at Groote Hospital in the trauma department at the moment, but I'm also here representing the People's Health Movement as their deputy secretary.
Thanks for joining us, James, and thank you for agreeing to do this session today. It's good to have somebody who's been at the front line to help us understand this COVID-19 situation that we found ourselves in. So to kick off, I'm going to introduce why we are here today. Section 27 is a public interest law center, and we're a nonprofit organization that focuses on advancing and promoting the rights to basic education and, more relevantly for this session, health. And our history is in access to medicines, and as we were formerly the AIDS Law Project, and we represented the Treatment Action Campaign in the case to get the government to give widespread access to ARVs. And so we felt that it was important to bring the issues around access to medicines in relation to vaccines for COVID-19. And so the purpose of this session is to address issues around misinformation, about myths around the COVID-19 vaccines, and to help people make informed decisions about whether or not to take the vaccine. Obviously, because we promote access to healthcare and access to medicines, we are pro-vaccines. We see it as one of the best ways for us all to get out of the cycle of lockdowns and to also ensure that people are able to go back to work and to ensure, most importantly, the health of people. And so we worked with the People's Health Movement, MSF, and other organizations to develop a manual, which we are calling the COVID Vaccine Literacy Manual, Train the Trainer Manual, to ensure that people in the community are able to answer these questions confidently and to also understand the journey that we've been on in relation to COVID-19. So a large proportion of South Africans and people who live in this country are hesitant. There's been research done by the HSRC and UJ that found in April that 52% of people were likely to take the vaccine. They were definitely going to take the vaccine. And that has increased to about 72% in the last batch of research that was done. So it's very few people who are saying that they would not take the vaccine, but it seems that they are quite vocal, particularly on social media. There's a lot of misinformation and disinformation circulating on those channels. And so what our aim is with this training and others is to equip people with the right information so that we can counter this kind of misinformation and disinformation. As I said, we worked with the People's Health Coalition and the working group, rather, of the People's Vaccine Campaign, and also the People's Vaccine Alliance, which is an international alliance of organizations, as well as PHM. It is for people who are interested in learning about this, about vaccines, but also all levels of society, health activists, anybody who has joined this session has an interest in getting the right information, and we would ask you to pass this information on. Julia has attached in the chat a copy of of the manual for you to share. This is, available everywhere, so you're more than welcome to send it across. And so what we are going to do in terms of running the session today is to answer some of your questions that you've already posted in your when you registered, and also we're going to ask you if you can post your questions on the chat or raise a hand if you are willing, if you're wanting to ask a question directly here. Julia, is there anything else that I've left out? Do you want to add something before we open up the session?
Great, thanks, Nsiki. I think just to kind of reiterate that Section 27 has worked with doctors and scientists to develop some materials about COVID-19 and vaccines, but I mean, myself, I'm not a doctor or a scientist, and there may be questions that come up today that we might not have the answers to immediately. But what we can commit to is doing the research and getting back to you. We have contact details for everybody who's on the call. So, if there are questions that we can't resolve over the space of a 2-hour session this morning, we will get back to you with more materials early next week. And just to thank everybody for joining. Before we jump into the kind of substance of the meeting today, we'd like to run a quick poll. It should sort of pop up on your device, on your screen. It's 4 quick questions just to get a sense of kind of where people are at with respect to information about vaccines, information about COVID. And then at the end of the session, we're going to ask the same questions. It's just really helpful for us to see how we can improve our sessions and, to see how we're going about communicating this information. So thanks again for joining. We're just going to run this poll. It might just be about kind of 3-4 minutes just to get a baseline of kind of where people are at. And for the people who are joining or perhaps joining us on the YouTube live stream, please feel free to introduce yourself on the chat box if you're in Zoom. But otherwise, for the people who are on YouTube, I see that there are a few people watching. Please feel free to contact us on the news@section27.org.za email address. We'll be monitoring that inbox today and keeping track of questions from there. And yeah, we really look forward to the session, and thanks for making the time available. I think that there are a number of organizations here from the public interest law sector, and it's fantastic that we've come together in the space to learn more. And I'm also aware that there are a number of kind of community organizations that are joining us today, which is also fantastic, and from all over the country. So thank you for joining from all of the corners of South Africa. And we'll be starting off just to give people a sense of what we're covering today. Shortly after the poll is finished, we're going to bring up an interactive Jamboard just to capture people's questions. A number of people did ask questions on the Zoom registration link, and we have written those down. But we'd like to open up the discussion either through the chat box or, as Nsiki said, if you feel comfortable to put up your hand, you're more than welcome to ask your question verbally. And we just want to capture as many questions as possible so that we can make sure that the information that we share today is relevant to what people want to know. We had intended to start with the very basics of how vaccines and how immunity works, just with the understanding that many people are coming to the space with different levels of understanding and knowledge about vaccines and the immune system. So just to cover the very bare basics, but then we'll get into the kind of more specific questions that have been raised on the Jamboard, and hopefully we can kind of share as much useful information as possible. Yeah, I think we'll let the poll run for another kind of 2 minutes or so. If you're struggling to kind of access the poll, you can send me a message. But otherwise, thanks again for joining us this morning.
I recall at the beginning of the pandemic, Zoom had some issues around security, and there were lots of Zoom bombers. We don't expect that we will have that same issue, but I note that there's a lot of Kyla Hazels that have joined here, and I assume it was because the link to her registration was shared widely. And so I would ask those who have joined to just click on the more part of the section of your name or Kyla's name and change your name to the person that you are, if you don't mind, so we can see who's actually in the room. Thank you.
All right, I'm going to close the poll now. Thank you all very much for just quickly answering those questions. We find it really helpful just from our from our perspective, just to get some feedback about what people feel at the beginning of a session and at the end of a session. We're going to jump in now to getting people's questions about COVID, about vaccines. This could be questions that are personal to you, questions that you have about, whether it's, whether you're worried that it's safe, whether you're worried about access issues, but it could also be, if there are questions coming up in your organization, in your communities, if there are myths coming up, or if there's information that you're not sure whether it's true or not, please feel free to share all of this. I am going to try share my screen now. Let's see. Here. And Six, can you see my screen?
Yes, I can, Julia.
Okay, great. So these are the questions that we had captured from before. And you know what, quickly before I proceed, let me share the link to this. If people would like to input questions directly onto this Jamboard, it is interactive, so you can input your questions yourself. And I've just shared the link in the chat. But these were some of the questions that came up in our registration forms, and we've kind of tried to group them so far.
Sorry, the screen that you've shared is the Section 27 webpage on vaccine literacy, which is great. This is where people can find more information. Okay. You just need to share the Jamboard.
Apologies about that. Let me give me 1 second. I have a classic situation of having too many tabs open. Bear with me. Let's see. All right. Can you see the Jamboard now?
That's the right one. Yes.
So yeah, we kind of tried to group some of these questions, and if you scroll to the top of your to the top of the Jamboard, you can kind of scroll left, scroll right, and there are there's room for people to add questions here. So we encourage you to kind of interact with this, but as Nsiki mentioned earlier, please feel free to share questions on the chat, or if you feel comfortable, to raise your hand and to ask your questions verbally. But yeah, we've kind of, there are a number of questions about side effects of the vaccine, sort of how the vaccine works within your body, how effective the different vaccines are. A question that came up once or twice was whether vaccines are compulsory for everybody to take. This is a question that Section 27 is receiving a lot in different community workshops that we've been running. There are also kind of questions about resources and access to more kind of materials and information. It's great that there's a hunger, that there's an appetite for this type of information. And it's great that organizations are willing to kind of come to a session like this and to learn more. Other issues about kind of chronic illnesses and how vaccines interact with people's pre-existing comorbidities. But let's open up to the chat now, and we can keep building this, and hopefully we'll answer as many of these questions as possible.
I don't see any new questions coming in, Jules. So if you don't mind going back to the first page, we will maybe look at some of the ones that we can answer now, or perhaps we can start with the 101 session and then see if there's any questions that get sparked as people are listening to that. What would you recommend?
Why don't we give it another minute or two just for people to, I see that there are some people on the Jamboard, and if you'd like to input directly, feel free. But let's give it another minute or two just to see whether any new questions come up. But then other than, if not, then we can dive straight into the meat of the discussion and come back to these questions and the more kind of specific things that arise later. But just to say, kind of, this is a, kind of, there are no wrong questions here, as cliched as that might seem. We really welcome the questions. It's a great way for us to learn as well, for us to update and kind of reflect on our materials and how we can improve them. And also to say that questions are natural at this point. With respect to kind of the way in which the vaccine rollout has gone, it's been quite quick, and there arguably have been challenges with government's ability to communicate how these vaccines work, how we know they're safe, what the side effects might be. A lot of people might feel concerned, and that's completely normal. I think many of us have had these concerns already. I see that there are a couple more questions coming in. Does the vaccine make you sterile? That's an important question about vaccines and fertility. Another question, why do people respond so differently after having received the jab? And is there a link between vaccine side effects and your level of immunity after? Great questions there. Thanks for inputting that.
See, there's a question on the chat, Jules, saying my concern is that I'm a chronic diabetic, and the writer is afraid to take the vaccine as a result. So that's a common one. And in fact, my mother is in the same situation. She is also a diabetic. And so we went to see her doctor, and he said that as long as her sugar levels are stabilized, she should take the vaccine, because the fact that diabetic people with chronic comorbidities are more likely to suffer more or to contract the virus. But Julia and James will address that kind of thing. Nontsikelelo is asking, what is the difference between the Johnson & Johnson and Pfizer, and why is Pfizer repeated? So we can definitely respond to that question in the discussion a little bit later.
Just to ask Nontsikelelo, do you mean why is Pfizer repeated in the sense that there is a second dose? You have to go for 2 injections. Another question coming in from Robbie Mohlakala. Does being vaccinated stop you from infecting others with the virus? This is a really important question. We'll put that down.
Yeah, so the follow-up question is about taking insulin. So the sugar levels are very high, and the person takes insulin. So there are other illnesses as well. It would be useful for James to weigh in as a medical health professional around this one.
Sure, I'll certainly cover that.
Thank you. Thanks, Shanaz. Noted.
This kind of section is looking quite crowded. I'm going to encourage people to go to the next page. Okay, somebody's already beat me to it. Vaccinated versus unvaccinated being asymptomatic and potentially either can be a carrier. That's a really important question about, whether or not you show symptoms and whether you can still transmit the virus if you don't have any symptoms. Thanks, Sonia. I see that you've just put that question on the chat as well. Thanks for that.
Marcy wants to know, have medical experts identified any long-term effects, or is it too soon to say? That's a really good question. And then Miles is saying, just worried if I'm to refuse the vaccine and may not be able to get to work in future. So yeah, we've been getting a lot of questions around mandatory vaccinations, and we're doing some research and discussing amongst ourselves what the position ought to be, and we'll tackle that.
So quickly to jump in here, there's a question on the chat about whether people who couldn't join today will be able to join another session in future. We were actually overwhelmed by the capacity today. More than 150 people registered for this discussion, and unfortunately our Zoom platform only allows 100 to join. So we will definitely have more sessions like this in future. It's great to see that there's such an interest in this type of information. And our details are available if you'd like to kind of ask us to run a session. We can definitely organize that again in future. But yeah, just for people who are kind of joining on the YouTube channel as well, just to say that this is a conversation that we're going to be continuing more in future as more updated information becomes available as well. I think
Jules, I don't know if we picked this one up about people who are allergic from police. Some people are allergic to injection. Is there any other alternative for them? That's a good question for James.
And I sense that we've got some really rich questions here. Hopefully we'll be able to cover as many of them as possible. Another question coming in from Uzair about vaccines' effect on women's ability to fall pregnant. This question about how it impacts fertility. I see that there's a question on the front page saying, is this not just pharmacies making money? Who's benefiting here? It's a really important political question. And there are kind of power dynamics at play, and there's definitely money involved. Something that we can reflect on maybe if we get a chance to talk about kind of the global access to these vaccines and who's in charge there. I'm wondering, should we pause the questions here? This is quite a lot, and we've got a limited amount of time today. I think we can jump into the kind of the basics about how vaccines work and the different vaccines that we have in South Africa and what different mechanisms those vaccines use. Also looking at side effects, looking at long-term effects, and then we can return to the kind of more specific questions after that. Just aware that people might have different kind of levels of knowledge coming into this. But let's see. All right, I think it looks like people have kind of put their questions on, but just a reminder that this Jamboard will be, it's live. You can always add to it. As and when questions come up or pop into your mind, please feel free to add them. Seeing that there are a few more questions here as well about, can you be forced to disclose your vaccination status? So that kind of links to the mandatory vaccination conversation, links to the question that somebody asked earlier about worried about not being able to find work in future if they don't want to get vaccinated. So we'll share the kind of current legal framework around that, and just kind of talk about that a bit more in the discussion. In that case, then I think I'm going to stop sharing this screen, but please feel free to continue adding questions, and we will try and cover as many of them as possible. So something that I'm going to pull up now, just to kind of get us on the same page here, is a set of posters that were originally developed by the People's Health Movement colleagues at James's organization. And they're really useful for understanding the basics of how the vaccines and the immune system work, and also describing the kind of differences in the vaccines that we have. So I'm just going to share my screen once more. Let's see. And Six, can you see the posters?
Yes, Jules, I can. We can see the post.
So I'm going to jump right in here and just kind of, and James, please feel free, please jump in whenever and make additions there. Just to start briefly looking at the history of vaccines and mentioning that, most of us on this call, if not all of us, have had vaccinations in our lifetime. In South Africa, we've got the extended program of immunization, I believe it's called, where children are vaccinated against a whole array of communicable diseases. And as a result, some of these are, so rare in our society now that we hardly see them anymore. Working with a colleague from People's Health Movement, Dr. Lydia Cairncross, she's kind of said, in her whole career of being a doctor, she's never actually treated somebody with diphtheria because the vaccines that we have against them are so effective. And just to stress that, although many childhood we're kind of used to children getting vaccines in South Africa, many adults will be vaccinated too. This isn't something that we just give to children. Whether it's vaccines against tetanus, rabies, yellow fever, the flu shot every year, HPV vaccines are given to women. They are given to children as well, young girls in grade 4. So, there's a strong history of a strong vaccination program in South Africa. And many of us have already been vaccinated in our lifetimes, although there are still some illnesses which we don't have an effective vaccine against yet. And we're hoping that the kind of research from these COVID vaccines will help us understand how to create better treatments and vaccines against HIV, tuberculosis, malaria. And just to say that kind of when we think about the vaccines that have been developed for COVID-19, it has been a very fast process. It's been, many of them have been developed over the course of a year, which is fast, but we've got this kind of, 100-year history about how vaccines work. And it's important to remember that these vaccines build on that history, and that there are similar illnesses to COVID-19, which we have vaccines against. So scientists kind of look at the existing body of knowledge and evidence about vaccines and have kind of tweaked it for this virus and for this context. When COVID, and I'm sure that many people know this, so please bear with us, it's very basic information here, but when COVID kind of enters your body, the virus, which looks a little bit like this, we've all seen pictures on it on every store sign at the moment. It has this kind of protein, which is called the spike protein, which it uses to get into your cells. And that spike protein is an important part of how the vaccines against COVID-19 have been developed, and we'll come back to that later. But essentially, the virus is spread through droplets of somebody who has the infection, which is why we've been told to wear masks, covering our noses and mouths, and that it gets into your cells, it spreads, and then it eventually causes this illness, which affects the respiratory system, but also, if I'm not mistaken, James, it does affect other systems in the body, including the, I've gone blank on the word for the different systems that it affects, but it kind of uses the spike protein to get into your cells and then spreads and affects various different systems and can make people very ill. Now, in terms of how vaccines work, it's helpful to have an understanding of how the immune system works, because vaccines kind of mimic the natural process that your body does when it fights off an infection. So we have a very kind of complicated system called the immune system in our body. which recognizes foreign germs or bacteria or viruses, which are, the kind of technical term for that is pathogen. And it kind of takes a while to figure out what this new, what this foreign, what this alien pathogen is and how it works. And then it tries to figure out how to get rid of it. And in doing this, it develops what we call antibodies. So if the immune system is the army of your body, it's the soldiers of your body, the weapons that these soldiers use are called antibodies. Now, in the case of COVID-19, the antibodies might look a little bit like this and prevent the spike protein from entering your cells. So it kind of creates a block around the virus and prevents it from entering your cells and making you very ill. And importantly, your immune system, it can take a couple days to sort of develop the right antibodies. This is when you might start showing symptoms. You might get a little bit of a fever. This is part of your body's way of making the body an uncomfortable place for the virus to live. And importantly, the immune system has a memory. So just like how you remember how your ex-boyfriend cheated on you, your immune system will remember COVID-19 if it ever comes into contact with it again, and it will be able to fight it off more quickly and more effectively once you've recovered from it and once you have these antibodies. Now, in terms of how vaccines work, it kind of mimics or copies this sort of process that your immune system goes through when you get a natural infection and when you recover from that infection. What happens with the case of vaccines is that a tiny, tiny, tiny element of the COVID-19 virus, which is the spike protein, is safely introduced to your body through an injection in this case. And either it is it is kind of a copy of that spike protein, or it might be some tiny, tiny, tiny genetic instructions about how to make the spike protein. And what this does is it triggers your immune response, and immediately your immune system recognizes that the spike protein is foreign, there's something dangerous about it, there's something alien about it. And it quickly works to develop the right antibodies to fight off that spike protein. And then what happens is that if you ever come into contact with COVID-19, the real full virus, again in future, if you get exposed to somebody who is positive with the virus, you already have the antibodies stored in your immune system to fight it off much quicker. And what the vaccines that we have against COVID do very effectively is that they prevent you from getting very sick and needing to be hospitalized with COVID-19, and they prevent you from dying from COVID-19. Now, many of the vaccines that we've all used in our lives, that we've had against children, that we had when we were children, prevent you from getting the illness full stop. Now, with the case of these COVID-19 vaccines, in many people, they will prevent you from getting sick at all, but they also prevent kind of severe illness and hospitalization from COVID-19, which is an important kind of part of the equation here, because we know that there's a huge amount of pressure on the healthcare system. There aren't enough beds, there aren't enough ventilators. So one of the kind of main motivations for getting vaccinated is that if you do get COVID-19, the chances of that are much, much, much less likely. And if you do get COVID-19, it will be a mild infection, which you should be able to treat at home. You might not need to be ventilated. You might not need oxygen. You might not need to be admitted to hospital. So while these vaccines aren't foolproof, they aren't a magic bullet that will take COVID away entirely, they will drastically reduce the severity of COVID and its impact on our health system and on our economy. And it will become more of a kind of illness that circulates, but that people can deal with by treating themselves at home. So this is how the general conversation about how vaccines work. And there were some questions in the chat about the different vaccines that we have, Johnson & Johnson versus Pfizer. But I see, James, do you quickly want to jump in here?
Yeah, I was just going to add on to your point, Julia, about what are the sort of what are we trying to do with vaccines? Are we trying to prevent infections entirely, or are we trying to prevent severe infections and death? So there was a recent article written with a statement by Prof. Mendelsohn, who's the head of infectious diseases at Groote Schuur, who stated that there are currently no people in Groote Schuur high care ward for COVID who have had the vaccine. And what this points to is that what we're really trying to do with vaccines is prevent hospitalization and death, these sort of severe side effects. While it would be fantastic that we could prevent cold and flu-like symptoms, a bit of sniffles, headache, and a cough, those basic symptoms, what we really care about is preventing people from going to hospital, having to use oxygen, or having to be intubated and put on a ventilator. And so those are the real priority areas that we talk about when we talk about how effective a vaccine is. And all of the vaccines that are in use in South Africa and in Europe and the United States have been shown to be highly effective at these outcomes.
Thanks for that, James. There are similar studies from the United Kingdom, from the US, which show that, of people who are in high care for COVID-19 in hospitals, the vast majority of them haven't been vaccinated, if not all of them haven't been vaccinated. So this is a really good kind of indication of the effectiveness of these vaccines against severe illness. You can unfortunately still get sick after getting vaccinated, but in most cases it will be very mild. From a personal perspective, I have relatives in my family who thankfully were vaccinated, more elderly relatives in my family who might have been at risk for a severe infection of COVID had they got it without a vaccine. And all of them, which were, my parents, my grandmother, were able to treat their symptoms at home. And most of them, really felt like it was just like a common cold or flu. They still had to self-isolate to prevent, onward transmission of the virus. But in the case of my family, I've seen the impact of how a vaccine has really, made this disease livable and I think saved their lives. And I think, many of us on this call will have lost somebody or, will have had a close, loved one or something who has had a severe infection with COVID-19, and the risks of the virus are very real. And this is one way of mitigating against that risk. An example that I've been told, which has kind of stayed in my mind, is that vaccines are a little bit like a seatbelt. If you wear a seatbelt in a car and you, God forbid, get into a car accident, you're much less likely to die or be severely injured by being thrown out of the windscreen. Whereas if you weren't wearing that seatbelt, the risks of getting into a car accident are much, much, much higher. So the vaccine is kind of like a seatbelt, which adds that extra level of protection against the severe, rarely dangerous risks of COVID-19. In terms of there was a question about there were a number of questions about the different vaccines that we have in South Africa, and also whether Pfizer, because it's an mRNA vaccine, which is a word that we've might be new to many of us. It's been thrown around quite a lot over the past year. I quickly want to stop sharing and bring up another page quickly. But I've seen that there is, okay, so Nkolisi has asked, how long does the vaccine dosage stay in the body after expired, and are we therefore safe? I think we'll come back to that shortly, but I quickly want to share my screen from the Train the Trainer manual. Just bear with me quickly. Right, give me 1 second. Okay, so currently the two vaccines that we have available in South Africa are the Johnson & Johnson or Janssen vaccine. And we also have the vaccine from Pfizer or BioNTech, which is sometimes called Comirnaty, which is a very strange word. There's some early stages of the South African Health Products Regulatory Authority looking at the Sinovac vaccine, which is produced in China. But currently it hasn't been rolled out yet, so we're just going to focus on Johnson & Johnson and Pfizer today. Sorry, is there a question coming in? Okay.
No, I think that was just an unmute by accident, Jules. Please go ahead.
Cool. Now, in terms of the Johnson & Johnson vaccine, there are a number of different ways in which vaccines are made, but they work similarly in your body. So the Johnson & Johnson vaccine uses a method called an adenovirus, which is a harmless virus, which can be, it doesn't actually replicate in your body and it doesn't create any symptoms in humans. But what it does is it uses this other virus as an envelope to introduce some information to your body And inside that envelope is a duplicate of the spike protein of the COVID-19 virus. And what that does is your body looks at this adenovirus with the spike protein inside, and it says, something's not right here. We need to figure out how to get rid of this as soon as we can. It develops the right antibodies, and then it stores the memory of how to recognize that spike protein and how to defeat it or beat the infection if ever it comes into contact with it again. So the kind of analogy that we've used with this is that it's almost like a postman who gives you an envelope or a letter, and your cells open up that letter, learn a bit more about COVID, and will be more able to fight off an infection again if ever they come into contact with it. Now, on the other hand, the Pfizer vaccine is a slightly newer technology. It's called mRNA. And I think that there's a little bit of kind of apprehension about mRNA because it sounds a bit like DNA, which is, our genetic makeup. And just to stress that this vaccine doesn't actually change anything about who you are. It won't change your hair color. It won't change your eye color. It won't change any of your genes. But what it does is it sends a tiny, tiny, tiny genetic message into your cells, which teaches your cells how to produce the spike protein itself. And as soon as your cells produce that spike protein, they ring the alarm because it's foreign, it's alien, it could be dangerous, and they develop the right antibodies to fight it off. So the example that we've given for this type of the vaccine is almost like receiving an SMS. So if I send you an SMS with a picture of COVID-19 in it, that picture cannot give you COVID-19 itself. It's just a picture which teaches you a little bit more about the virus and helps you recognize the virus in future, and a set of instructions which will tell you how to create the right weapons to fight off that virus if ever you come into contact with it again. Now, it's worth stressing here again that mRNA doesn't actually stay in your cells for very long. This tiny message actually dissolves very quickly. And I don't know whether, James, maybe whether you know the specifics about this, but I've read that, the mRNA vaccine, actually, the mRNA itself doesn't stay in your cells for longer than 2 or 3 days. It transmits this message, it sends this message, and then it disintegrates in your cells. So it doesn't stay in your body, it doesn't change who you are. But what does stay in your body is the learning, is the lesson that mRNA instruction gives you. And that's what, helps your immune system develop the right antibodies, remember COVID-19, recognize it if you ever get exposed to it again, and then defeat it as fast as possible. So another kind of, I don't know whether this is any comforts at all, but mRNA is sorry, I'm at the office in Braamfontein, and there's a lot of traffic noise outside. I hope that isn't disturbing. mRNA is very fragile. It's very small. It's completely, it's tiny, it's microscopic. And it survives best at very cold temperatures. So in order to store these Pfizer vaccines, we need to have intense cold storage facilities and systems, and it needs to be minus 70 degrees centigrade. And all of our bodies operate at a kind of temperature of around 36 degrees, if I'm not mistaken, which is another reason of kind of showing that the mRNA won't stay in your body for very long because it can't survive at that temperature. But what it does do is it sends a message to your cells with these instructions. So you don't have to worry about this mRNA being within you and changing you for long periods of time. But what it does do is it very effectively teaches your body how to make these antibodies. James?
Yeah, I'll just jump in here, Julia. So I think that's like one clear thing to take away from this part of the discussion around mRNA, which is this thing that has come into everyone's minds in recent months, and it's a new thing that lots of people haven't heard about. And when people hear mRNA, they hear DNA, they hear genetic, they hear gene therapy, all of these words are bandied about, which really don't mean the same things. mRNA is to DNA, is to DNA the same way like a factory worker is to the president of South Africa. They're completely separate parts of the system. Although they both are used in the term genetic, they're completely separate parts of the system. So when we say that we're giving a vaccine that contains mRNA, and somebody says to you, I don't want to have gene therapy or my genes altered, they're really not talking about the same thing at all. mRNA is a very separate messenger material that's used to instruct your body to make certain proteins in the parts of the cell called a ribosome, but that's not very important. And basically, it only instructs the cells to make these proteins. And that's all it does. It's just a blueprint of, like Julia said, a photograph or even a fax is probably a good analogy. A fax with a set of instructions, just a set of letters that tells your cells how to make this spike protein that we've chosen as something that's highly recognizable. And so there's no real way at all, even theoretically, that this can interact with your DNA or what makes you you.
Thanks, James. And I think it's, yeah, I mean, just to reiterate that neither, a vaccine cannot actually give you COVID-19. It cannot give you the virus. The kind of the part of the virus that the vaccine will introduce into your body is too small and too weak. It's a tiny, tiny, tiny fragment. So if you get COVID-19 after being vaccinated, it's likely that you were exposed to somebody with a positive infection. And it's not the actual vaccine that is making you come down with COVID or potentially get sick. And, we'll talk a little bit about side effects shortly because, some of the side effects actually look like COVID-19. You might get a fever, you might get body chills, and we've been told to kind of, look out for those when dealing with COVID. But just to kind of, I think that there's a fear circulating that the vaccine can give you the virus and make you sick. And it's actually impossible for the vaccine to do that. They haven't been produced in that way. Now, I remember that there was a question specifically about Pfizer, about why it's repeated. So the way I've heard this described, and James, I'd love it if you can chip in here, is that, vaccines use different mechanisms to teach your body how to make the antibodies. And that in the case of the Pfizer vaccine, it's almost like a little kind of reminder that the second shot gives your body. The way it was described to me was a little like when we were at school and we had exams coming up, we would cover the content, and then there would be a week or two before the exams where we did revision and where the teacher would consolidate our knowledge, make sure that we remembered everything, make sure that everything was really fresh in our mind so that when we took the exam itself, that information was at the top of our mind and we were able to answer the questions adequately. So the second vaccine shot with Pfizer is kind of like that exam revision. It helps prepare your immune system that little bit much more so that if ever you do come into contact with COVID and you have to take the exam or take the test of fighting off COVID-19, you're much more prepared. But I don't know, James, do you want to jump in there?
Yeah, and I think it also relates just to the way the intentions behind when they were developed. So, for example, the two that you have on the screen, the Oxford AstraZeneca and the Pfizer vaccine, are both two-dose vaccines. And that was really the intention, that they were going after something that you could produce an initial immune protection, and then, like Julia says, a reminder or an update that could induce a longer duration of protection, so that your body is exposed twice, it gets double the lesson, etc. With the Johnson & Johnson vaccine, in the trials, they simply trialed it as a single vaccine dose. And there's talk also of future top-up doses that we can probably talk about, that maybe down the line people will need further doses. And there's also the reverse being talked about, which is that in certain cases down the line, we might have good data that even a single dose of one of the Pfizer vaccines is good enough to protect us. We know this from other vaccines, for example, the yellow fever vaccine, that if people have traveled out of South Africa to a number of tropical countries, they would know that you would require the yellow fever vaccine, which used to be thought that you would have to get repeat vaccinations of the yellow fever vaccine. So you'd have to produce a recent vaccination card showing that you'd had the yellow fever vaccine within recent years. We now know that the efficacy of one single dose of yellow fever vaccine is enough to protect you for a lifetime. And that's simply because we've had enough time now to observe people who've had the vaccine over their lifetime and see that they are protected. So it may be that in future, we realize that we are getting enough immune response from even a single dose, or that in the case of variants, we might need new vaccine doses down the line.
It's worth adding here that, just because, so Johnson & Johnson is one injection and Pfizer is 2 injections, which are spaced out 42 days apart. And it's worth saying that both are very effective and very safe, and both prevent severe illness and death from COVID-19. I think sometimes there's a fear that if you get Pfizer, well, rather, let me rephrase this. Something that I've heard in some of the workshops that I've been running is that, is Pfizer double as effective as Johnson & Johnson because it's 2 doses and not 1? And it's just important to remember that these vaccines are completely different and use different mechanisms, but both work similarly in your body, and both, with the evidence that we have currently, are very effective at preventing a severe illness and death from COVID. In many people, both of these vaccines will prevent you from catching COVID at all. It really just depends on, your exposure and that kind of thing. And that's, we shouldn't necessarily be worried about which vaccine we want to get, because both have been approved by, both have been checked by the South African Health Products Regulatory Authority, and both have, the data for both of these vaccines is very, very, very strong. And, when we hear phrases like, for example, I think I've gone blank on the numbers here. I'll have to pick it up in the posters. Bear with me for one moment. When we hear, for example, with the Johnson & Johnson vaccine, that it is, 81% effective against COVID, there might be a worry, like, why isn't it 100% effective? With Pfizer, it's, the number is slightly higher. It's 95% effective against getting a symptomatic case of COVID. But it's important to remember that no medicine is 100% effective in every single person. And, the example that we've been giving is, for many people, if you have a headache, Panado will be fine. But there are some people who, Panado doesn't actually help them. It doesn't get rid of the symptoms. It doesn't work. And this is true of all medicines. And, this kind of, high rate of efficacy, or effectiveness rather, with the Johnson & Johnson vaccine and with the Pfizer vaccines is actually incredible, because, the protection that they give is very strong. And the protection that they give against Delta, the variant that is currently kind of predominant in South Africa, is also very strong. I know that I'm jumping around quite a lot with the various kind of slides here, but I'm quickly going to stop sharing and show you some information about the kind of current information that we have with respect to how the vaccines work against Delta. Sorry, bear with me here.
Can I jump in so long, Julia?
Please go ahead.
Yeah, I just wanted to answer, there was a specific question in the chat to me about the efficacy of the single Pfizer shot. I think also, just back to Julia's numbers on Johnson, again, what we're measuring when we report effectiveness is normally the way that we calculate it in these trials is that we use an endpoint of infection. So we say that it's 81% or 85% effective against people getting infected with COVID and presenting with symptomatic COVID. But even the Johnson & Johnson vaccine has been shown to be 100% effective against mortality in its initial trials. So even though its efficacy data compared to Pfizer in preventing infection seem to be lower, there's been, after looking at that data, we now know that it has at least equal or comparable efficacy in preventing deaths, which is the outcome that we really are concerned about. And then on to the single Pfizer shot. I mean, I've tried to look up some of the statistics on the efficacy of a single Pfizer shot. I think different analyses report around 89% effective if it's given enough time, but that range is between 52 and 97%. So it's quite a wide range. After the second dose, that efficacy goes up to above 91 to 95%. So it's a bit difficult to tell how effective the single dose is. It depends on how long after your vaccine you've waited to give the body time to respond. But it does seem to be quite a lot of protection even from a single Pfizer shot.
I think, and this links to one of the questions that was raised earlier on the Jamboard, is like, do we know enough yet? And I think, at this point, we've had these vaccines for just over a year. There is more and more data becoming available about how effective the vaccines are at preventing different kind of phases of infection, or different severity of infection rather. And that's, kind of right now, what we know best is that Pfizer is most effective after the second shot at protecting you against severe illness and death. And we've been doing some work on community radios with Section 27, and somebody called in and said, I had horrible side effects after the first Pfizer shot. Do I have to go back and get my second one? And, in answer to that, we would encourage everybody to, yes, go back and get your second shot, because you get better, longer, and stronger protection after getting both of those Pfizer shots than you would the first shot. We'll know more in a couple of years' time about, as James is saying, quite how effective the first shot is. But currently, the way this vaccine has been designed is with both doses. And, we encourage you to, despite the side effects, go back and get your second shot, and government will send you reminder SMSs about, this is when you need to come back for your second shot. And this is to confirm that you've received the full vaccination, is what they're calling it. With respect to kind of the Delta variant and sort of variants in general and what we know about vaccines, there are a couple kind of really promising statements from reliable sources like the World Health Organization, where they say that the vaccines that have been listed with the World Health Organization all have broadly neutralizing antibodies, and that all emergency use listed vaccines do protect against developing severe disease, hospitalization, and death due to the Delta variant. And South Africa only uses vaccines that have been added to this emergency use list from the World Health Organization. We don't get vaccines that haven't been approved by kind of various international bodies. On the home front, in terms of the research that is being conducted by scientists in South Africa, the National Institute for Communicable Diseases had said something similar, with COVID-19 vaccines remaining highly effective in preventing severe disease after Delta variant infection, with the Pfizer vaccine showing 96% efficacy after 2 doses. And Johnson & Johnson, this was from, I think I wrote the slide about a month or two ago, but they were saying that, the COVID-19 vaccine elicited even higher antibody activity against Delta than it had against Beta, which was the kind of previous variant that we had in South Africa. So in short, yes, the vaccines do work against preventing hospitalization and death from Delta variant. And also it's worth saying that, we learn more and more about these vaccines every day, the more people get vaccinated, and that vaccines can be adapted over time. We might have a situation in the future where we might need booster shots. There's been some talk of that. I think, and James, correct me if I'm wrong here, for something like tetanus or rabies, you might need a booster shot after, a couple years. With respect to, the flu vaccine, that is seasonal, that happens every year. So there is a chance that we might need future injections or, kind of like a second shot, a booster shot. But we don't know yet, because scientists haven't had enough time with the vaccines and with the virus to kind of understand how strong the protection is. But I think there is urgency in getting vaccinated now. I think, there's sometimes a fear that, is it actually worth it? Because if I'm just going to have to be vaccinated again in future, how strong are these vaccines? But in an immediate sense, the protection that you get from these vaccines that we have access to in South Africa, which have been proven to be safe and effective through various regulatory authorities around the world, they've all said that this is, that these vaccines are do what they say they're going to do, which is prevent death from COVID, and are safe with respect to kind of how it impacts your body. And I think there is an urgency to get vaccinated as soon as possible, so that we can take pressure off of our healthcare system, so that our economy can return to normal, and so that our lives can, kind of return to normal in some sense. I think I wonder whether it's worth kind of talking a little bit about side effects now, because I know that was a question, side effects and long-term effects of the vaccines, because that was also something that had come up in the questions. Let me ring up the, sorry, bear with me. Let me ring up the posters again.
While you do that, Jules, there's a couple more that have just come in, which are in line with what you're addressing now, I think. One question was, how long should one wait to get their first shot after they've had cold, flu, or fever? The other was if someone is not feeling well and they're not feeling well and getting vaccine, what happened if someone gets vaccinated while not feeling well and ignores the feeling? And then the last one, if someone is having gout, does the vaccine complicate the gout? So I think that those kind of relate to what you're going to be talking about now.
Sure, those are great questions. With respect to kind of, whether you currently have symptoms and whether you have like a flu or a cold or something like that, I think, and James, I'm gonna maybe pass the buck to you on some of these.
Sure.
The evidence that I've seen is that if you have had COVID-19, you must wait for at least a month before going to get your vaccine, because your body is still fighting off the virus and kind of needs that time to recover, and you don't want to sort of put too much pressure on your immune system. With respect to flu, I remember reading that you should wait kind of 2 weeks between getting a flu infection, getting a flu vaccine and then going for a COVID vaccine. So I'm not sure whether that also, whether that tells us a little bit about flu. James, do you know about that?
Yeah, I mean, I'll answer. I'll touch on the 3 questions. So yeah, you're right that the current recommendation for somebody who has cold and flu-like symptoms and then ends up testing positive for COVID is to wait 30 days from testing positive before they get the COVID vaccine. One reason being just to allow you to recover. I mean, not too much going on at once, allow yourself to get well. Also that you're not going into a vaccination center while you're still actively carrying COVID and then spreading the virus. That's one of the other reasons why we would delay somebody getting a vaccine if they are currently acutely ill, is that potentially that they are needing to be treated for something else. And that's really the priority at that moment. And the other reason being that after your body has generated an immune response, we want to then give them the dose so that they then have a new immune response generated, and it's not all at the same time, to get the maximum benefit out of the vaccine. So this is one of the reasons why if you have the flu vaccine or the COVID vaccine and you wanted to get both, they don't generally give them at the same time. They give one and then they allow a 1 to 2 week period before giving the other, to allow the immune response and the full immune memory to develop before you're given another vaccine. On the gout question, there's currently no evidence that vaccines are contraindicated in gout. A number of rheumatology societies have made statements about that. There's no reason to not get the vaccine in cases of gout. And I'll also touch on a question that we received, which is in cases of porphyria, which is a generally congenital condition. People asked whether they were able to get the vaccine, as they are not able to take a large number of certain drugs because it causes acute attacks in them. The American Porphyria Association and the National Health Service of the United Kingdom have both made statements to say that there's no reason not to get the COVID vaccine if you are known with porphyria as well.
And I think this sort of leads us to the broader question about comorbidities. In the case there were a number of questions about diabetes, for example. We've also been told in other workshops, asking people asking like, I have hypertension, I have heart problems, should I get this vaccine? And I think it's also worth kind of remembering that people with these comorbidities are at higher risk of getting a severe case of COVID and having complications from COVID. And in that case, it's very important to get vaccinated because it adds this layer of protection and can help protect you against getting the severe case of COVID-19. So the doctors who we'd spoken to from Doctors Without Borders had said that anybody who's kind of on treatment for diabetes, hypertension, HIV, and is consistent with their treatment, there is no reason not to get the vaccine. And I think quite a recent study about HIV suggested that people with HIV are actually more likely to develop a severe case of COVID-19 and to need to be hospitalized and might actually have a higher risk of dying from COVID. And with that in mind, it's very important to get vaccinated against COVID so that you kind of reduce that risk and keep yourself safe. James, do you know anything about, should we kind of jump to the comorbidity discussion now?
Sure, I think we can jump into comorbidities.
I think, Shame, I'm kind of jumping around here, but there were just lots of kind of different questions. Or should we quickly talk about the side effects after getting vaccinated and then kind of go into the various different comorbidities?
I think that's probably a good idea. Then people will probably ask if there are certain side effects that happen more commonly or should be avoided because of their comorbidities, and you can cover both in one swoop.
Cool. So the different vaccines that we have in South Africa, they have slightly different side effects. With Johnson & Johnson, the very common side effects are that you'll get a little bit of pain in the arm that they injected you in. It might swell, you might get muscle aches, you might feel a little bit nauseous, and another common side effect is tiredness, fever, and headache. But with these side effects, it's important to note, first of all, that many people might not get side effects at all. My mother got vaccinated, she didn't get any side effects, she was totally fine. But most of the side effects only last for about 2 to 3 days, if that. When I got vaccinated with the Johnson & Johnson vaccine in May of this year, that night I had a bit of kind of muscle aches, a little bit of a kind of hot and cold fever, but the next morning I really felt fine. I think with respect to these side effects, you can treat them at home with Panado or paracetamol. And it's also kind of worth noting that this could actually be a very good sign that your body is developing the antibodies. The kind of technical term for this is reactogenicity, I believe, which means that your body has recognized that there's a vaccine in your system. It is gearing up its immune response to kind of prepare the right antibodies, to learn the lesson from the vaccine so that you get a strong immune response in future. With respect to kind of the more severe side effects and the more kind of rare side effects from vaccines, there were a number of questions, for example, about allergies to vaccines. I think that I'm not sure if there was a question today about blood clots. From what I understand, most people who have allergies to vaccines will already know that they are allergic to vaccines because they will have been vaccinated in their lifetime. I'm not sure, James, do you want to jump in on that? Are there any specific allergy kind of warnings here?
I will jump in. So I think that with the question of when people say things like, or particularly in a medical setting, they say things like, doctor, I'm allergic to vaccines, or doctor, I've had previously had bad reactions to injections, I'm allergic to injections. It's important to figure out what is meant by that, and what specifically they are allergic to. So in some cases, people are not, so particularly with vaccines, people are often not allergic to the components of the vaccine, but they are allergic to some of the manufacturing procedures. So, for example, some of the flu vaccines have previously been developed in chicken egg cells, basically. And there are people who are allergic to chicken eggs who then develop an allergy to the vaccine, to the flu vaccine, for which there are alternative flu vaccines which do not contain this component. So when somebody's allergic to the flu vaccine, it might just be that they're allergic to eggs. That's one sort of glib example of what we mean by when people say they're allergic to something, they might be allergic to something other than that, other than what they're aware of. And so and it's the same thing with injections. When people say that they're allergic to injections, it's highly unlikely that they're allergic to the needle itself when they're saying injections. They're allergic to some sort of component in something that they've had in an injection previously. And it might have been that it wasn't a vaccine, it was a penicillin injection or an antibiotic injection. And even in these cases, there are other versions of antibiotics that we could give to people that don't have the same allergic reactions. So people, when people have had allergic reactions previously, be it to a vaccine perhaps, or a medication perhaps, it's important that the medical practitioner who's giving the vaccine be aware, and to look at whether any of the allergic events that are being reported have an overlap in what might be contained in this vaccine, because it might just be completely separate. And then, even despite that, allergic events are exceedingly rare, and for the large part are quite manageable. And that is why at any of these vaccine sites that you go to, you'll see that they make sure to keep you for 15 to 30 minutes afterwards, and that there is medical supplies and emergency medical equipment on site in case there is an allergic event to the vaccine. So basically the point that I'm making is that because you've previously been allergic to a vaccine or an antibiotic or something before, or had a bad reaction, it does not necessarily mean that you are going to be allergic to this COVID vaccine now.
With respect to the question that said, are there any alternatives for people who have a history of allergic reactions to vaccines? As far as I understand, there isn't another, there isn't like a drop that you can take, for example. There aren't other versions of these vaccines yet, but they might become available in the future.
Yeah. So I mean, there are not. I mean, there's the Johnson vaccine, there's the Pfizer vaccine, and those are the ones that are available in South Africa at the moment. But what we can rest assured in is that we know the components of these vaccines. We know that none of these vaccines were developed using egg cells. We know that none of the vaccines have components of other things like shellfish, which is another common allergy that people have. And so these immunogenic is the word, compounds or proteins that are found in these other vaccines that are commonly cause allergies are not found in the current COVID vaccines. So that if you are somebody who is prone to allergic reactions to other things, it does not necessarily mean that you should avoid getting the COVID vaccine. It would just simply bring it up to the medical professional, make sure that they're aware, understand your background, and then for them to discuss with you your choice.
It's kind of worth adding that, food allergies, animal allergies are different to medical allergies. And if you have a lot of, sort of seasonal allergies for something like that, that doesn't necessarily mean that you'll be allergic to this vaccine. The allergic vaccine, the allergic reactions or the kind of adverse reactions to these vaccines are very slim, are very rare rather. And something that James mentioned is that at the vaccine site, what happens is you queue. Somebody, usually a nurse or a healthcare worker will screen you, will ask, sort of, have you had COVID recently? Have you had a flu vaccine recently? Do you have a history of blood clots? And they'll talk you through the kind of, the different options available to you if you answer yes to any of those. And then after receiving the vaccine, they ask you to sit and wait for 15 minutes in an observation area. And the understanding there is that, in the vast majority of allergic reactions or anaphylaxis to a vaccine, it happens immediately after the injection, I believe, which is why they ask you to wait around for 15 minutes so that there are kind of healthcare professionals on hand who have been trained with how to deal with those situations if they arise. But it's been very rare. At some of the vaccine sites that I've been to two, we were helping volunteer register people. One of the nurses told me that she's actually never had to deal with an adverse reaction at Charlotte Macleay Hospital in Johannesburg. There might have been, other cases in other sites, but that these allergic reactions are very, very, very rare. With respect to Pfizer, the common side effects are slightly different to Johnson & Johnson. Again, you might get tiredness, fever, headache, muscle aches, a little bit of swelling or a little bit of pain around the injection site. But again, these tend to go away after 2 or 3 days. And it's also worth kind of noting that, don't be put off by the side effects with the first shot, and don't let that discourage you to get the second shot. And I guess just a reminder that all medicines have side effects, and they vary in kind of, in severity or seriousness. And what the scientists and doctors have been saying about these side effects is that they are actually kind of much smaller, much more manageable, and much kind of, in proportion to the risks of COVID, these side effects are very manageable, which is part of the reason why they have been approved as kind of vaccines that are safe. If a vaccine in the trial process has too many very severe side effects, then it gets kind of cut from the, it won't be approved, it won't be kind of manufactured, because side effects is something that scientists look for in clinical trials of vaccines to understand whether a vaccine is safe and whether the risks of taking the vaccine are in proportion to the risks of the disease that we're trying to prevent. So, again, kind of the side effect question comes up quite a lot, but it's worth saying that, this will last for 2 or 3 days, whereas the risks of COVID are very real and might last a very long time. The kind of, whether it's the risk of needing to be hospitalized, intubated, ventilated, needing oxygen, needing acute care, but also the kind of long-term side effects of having COVID. We're reading more and more about this thing called long COVID, where the fatigue, the body aches can kind of continue for a very long time. So if it's comforting at all, these side effects, the common side effects from the Pfizer and Johnson & Johnson vaccines tend to go away within 2 days. Whereas in comparison to COVID itself, that could be a much longer time, and the risks of that are much higher. But ultimately, it's up to you as an individual, knowing your own medical history, to make an informed decision about what you want to do. I wonder whether, James, do you want to bring up the slide that you showed me earlier about the adverse events following immunization, just to kind of put it in context? I can stop sharing my screen.
Let me see how to do that.
I think I've given you permission to share.
Okay.
Give me 1 second.
Okay, I'll share my screen.
Cool.
Okay, is this the right screen? Okay, so I don't know if everyone can see. This is the SAHPRA website, SAHPRA. The edge is being cut off. So SAHPRA is the South African Health Products Regulatory Authority. It is the official body that is responsible for protecting South Africans and South African medical providers from to ensure regulatory compliance amongst them in the medications that we are allowed to prescribe and to give to patients. And SAHPRA has recently published this dashboard. So it's an open access dashboard that anyone can take a look at, where they keep a track of both the number of doses administered in South Africa and of the reported adverse events. So this abbreviation AEFI is the technical abbreviation for adverse events following immunization. And this includes all events that have been reported in the country through official channels. So there's a number of ways that events are being reported in South Africa. One is there's a specific app that has been developed, Med Safety app, that people from the members of the public can use to report any side effects that they have after the vaccine, or medical professionals or members of the public can submit a hard copy form or a digital version of a form to SAHPRA that is then investigated. So if we look at this numbers on the left, you'll see that there's over 8 million cumulative doses have been given in South Africa, and there's 1,900.
Just to say that we're now up to 13 million doses that have been administered in South Africa.
Okay, yeah, sorry, I'm opened on the 13 May to 13 August tab here, so apologies. It's just a subsection of the current doses, and at the bottom, the fraction of these doses that have had adverse events reported is 0.02%. So less than 0.02% of those people who've had vaccines during this period had adverse events reported. And still 1,932 might sound like a lot to you, but if we go down and look at the breakdown, let me try and see if I can do this on this tab. We see that the majority of these events that are being reported, so here's a graph for us, are quite minor and well-known symptoms. They're things like chills, feeling dizzy, feeling tired, having a headache seems to be one of the major adverse events reported. A local reaction, this is just what we call anything that happens to the arm site. So if you have a bit of swelling or pain, nausea, pain at the site, etc. Pyrexia is just a word for fever. So the majority of these adverse events, which is the technical term, are simply symptoms that we are expecting. They're symptoms that are quite common. The symptoms that I experienced when I had my vaccine. They're symptoms that Julia mentioned that she might have experienced as well. And a lot of people. So when we talk about adverse events or side effects, more than 99% of the side effects we're talking about are these sort of side effects, are the side effects of a local reaction or a minor systemic reaction, feeling flu-y, feeling cold, hot and cold, feeling a bit muscle aches that goes away within 1 to 2 days. But they are still being reported to SAHPRA, just so that SAHPRA can make sure that they are associated with the vaccine and if there's anything more concerning going on. So we see that even amongst the huge number of vaccines that are being given, there's such a small number of adverse events being reported, and the majority of these adverse events are extremely minor. SAHPRA recently published a research piece where it looked at all of the reported deaths in South Africa and analyzed whether any of them were associated with the COVID vaccine, and they were not able to find any deaths that were directly associated with the more than 13 million doses now given in South Africa. So that's some really positive news. And in terms of keeping the public aware, it's really positive that we now have an open access dashboard that people can check in on and see if there's anything to be worried about. And you can see that there's very similar low rates of side effects in the Pfizer vaccine and in the Johnson & Johnson vaccine. So I think I'll stop sharing the screen, but if people want the link, I'll put it in the chat.
Thanks, James. That would be great to share. It's also kind of, I think this is a question that comes up a lot, is like people die after getting vaccinated. Is that because of the vaccine? What SAHPRA has said is they've investigated all of those deaths and they found that none of them were directly linked to the vaccine. Of course, the deaths are still very unfortunate, very tragic. And I guess just to kind of, this is a myth that circulates on WhatsApp groups and social media that, if you get the vaccine, this person died after getting the vaccine. And obviously the vaccine is not a cure for everything. It's not a magic bullet. But we do know scientifically that the vaccine does not directly link to those deaths. And that, in the case of South Africa, there are a large number of people who have undiagnosed comorbidities or other conditions which might be responsible for those mortalities. With respect to kind of one of the more kind of like rare side effects that's been kind of shared quite a lot, we've kind of heard a lot about blood clots over the past year or two. Now, this is from Canada, and it is, it's talking about the AstraZeneca vaccine, but I think it's helpful to compare what the risks of getting a blood clot are with a vaccine to other kind of common illnesses or common problems. So many women in South Africa will take birth control contraceptive pills, and those kind of increase your risk for blood clots substantially. It's, in Canada, that's 901 million, so that's 0.09%. Other kind of risk factors like smoking and drinking can increase your risk of blood clots much higher than what a vaccine can. And it's also kind of worth remembering that many of the people who develop a severe case of COVID-19 will develop blood clots while in hospital. And this is sometimes, if I'm not mistaken, James, the cause of death for people who die from COVID. So with respect to the kind of comparing the risk of getting a blood clot from COVID itself versus getting a blood clot from a vaccine, the risks are much, much, much lower for getting a vaccine than it is from getting COVID itself. And again, this is something at the vaccine site that they will ask you if you have a history in your family or in your case of having a thrombosis or having a blood clotting condition. But just to say that in comparison to other, smoking, birth control, this one gives the case of an average Canadian. Many people get blood clots from sitting down for too long. The risks of getting a blood clot from a vaccine are actually much lower. So this is one of the kind of the severe side effects that has been spoken about. There was a brief kind of pause of the Johnson & Johnson implementation trial in South Africa in May of this year to investigate the kind of the risk of blood clots with Johnson & Johnson. They found, I believe, that it was 7 people out of 7 million people who had been vaccinated who got a blood clot from the vaccine, which is a much lower risk than the number of people who get blood clots from COVID itself. So again, kind of, I think these vaccines are very safe, very effective. The side effects, and particularly the severe ones, are very rare. And ultimately, you will know your body, you know your medical history, and it is up to you to kind of assess the different risks that are kind of put in front of you, and to try and take the option that has the least risk for your kind of medical conditions.
Can I touch in there,
Sure.
Julia? Yeah, so I think that it's important when we're presented with single facts, that's where a lot of the problem comes in. So when you're presented, or you're told by a family friend or somebody that you know at work who says, did you know you can get a blood clot from vaccines? Or somebody says, my uncle's aunt's brother, etc., got pneumonia after getting the vaccine. Those single facts make it seem to you that the vaccine is what's caused this. It makes it seem to you that the vaccine is what is a problem that I should therefore avoid. But you have to look at things in context. And in context, we know that there are more than 2 billion doses of COVID vaccines have been given worldwide. COVID vaccines are the most highly studied vaccines in all of human history. There's more published data on the COVID vaccines than there is on any previously used vaccine in human history, going back to the invention of vaccines. And that's simply because of the scale of public interest and the amount of investment at the political level in the COVID vaccines, and also because of the amount of media scrutiny of vaccine side effects, etc. So the COVID vaccines are one of the most highly studied medications that we have on offer at all, including all other medications that are given as chronic medications to you quite easily at a local clinic level. And so that's the context. And the context that Julia is providing is that when there's so many people getting vaccines, of course there are going to be people that present with weird and wonderful illnesses, or even things like, one of the adverse events that you have to report is if somebody gets into a car accident after having a vaccination. So all of these things that you can report does not mean that they're linked to the vaccine at all. It's simply because we have over 2 billion people 2 billion doses in 1 billion people that have been vaccinated. So these 1 billion people are going to have all sorts of diseases that they would normally have had anyway. And then the other important thing that Julia touched on is, what are we comparing this to? We're comparing this to if you get COVID. And if you get COVID, the risk of significant illness, the risk of needing ventilatory support, oxygen therapy, the risk of blood clots, the fact that if you're admitted to hospital, you will be given something to prevent blood clots, to thin your blood. All of these things that if you do have COVID, all of these risks are significantly, I'm talking if the risk of a blood clot is less than 0.01%, and the risk of a blood clot in someone with severe COVID being around 14%, I think it was in the Canadian population, that's over 100 times increased risk of these things if you do have COVID. And that's really the context that you want to provide. So not looking at the single numbers, looking at what are you actually weighing it up against? You're weighing it up against the risks that you would have in your general life, which could be all sorts of things, and the hugely increased risk of death, of needing to be hospitalized, of having long-term COVID symptoms if you do get COVID without the vaccine.
Absolutely. Thanks, James. I think, I receive chain messages from family and community WhatsApp groups all the time. There's a lot of stuff going on social media, and it's completely understandable that people are worried because there is so much information going around. But I think part of what we're trying to do here today is to kind of provide a context to the information that you might be receiving, and also kind of maybe just kind of draw attention to some of the ways that we can identify whether information is reliable, whether we can trust that information, whether maybe it's an anecdote that has been blown out of proportion. And this is not to say that people's fears aren't legitimate or aren't valid, but just to say that kind of, it's important to contextualize where these stories are coming from and to compare it to scientific evidence that we can trust. There are a number of sources in the manual that I've shared on the chat. Let me just find the right page for you, that we drew from to build this manual. And there are kind of some trustworthy sources that we recommend. So, Section 27 works very closely with an online healthcare publication called Spotlight. There are, sources from the Department of Health, sources from the National Institute of Communicable Diseases. There is a very helpful tool down here, which is called What's Crap on WhatsApp. If you receive a chain mail and you're not sure whether it's true, you can send it to this team at Africa Check and they will verify it for you. They will fact check it for you. So I guess just to say that, there's a lot of information circulating. A lot of it is very frightening. If you have questions, further, you can always address them to Section 27 and we'll try our best to answer them. But, to try and kind of trust the reliable sources more than the kind of tunny on the WhatsApp group who shared something from someone, and then it becomes, a broken telephone situation. Becky Sisa is another kind of really great source for reliable information. I wonder whether we'd spoken a bit about blood clots and the contraceptive pill, and that kind of linked in my head to the question of fertility, which was raised. I wonder whether we should quickly jump on that. There's a kind of, that has been a concern. What the kind of South African Society of Obstetricians and Gynecologists is saying is that, women who are pregnant or who are breastfeeding actually should get vaccinated, because the risks of getting a severe case of COVID while you're pregnant, because sometimes there's, the kind of side effect of hypertension during pregnancy. The risks of that are very high, and there are a number of pregnant women who have needed to go into acute care or intense care rather with COVID-19, and the risk of getting vaccination for pregnant women is actually very, very low. But in terms of fertility more generally, my understanding is that the vaccine affects your immune system, but not in any way your reproductive system. James, do you have any more information about that?
Sure, yeah, I'll touch on both points. So yes, the South African Society of Obstetrics and Gynecology has looked at the vaccine data and has made a decision regarding whether it is okay for pregnant women and those in childbearing ages to have the vaccine. And they've made the recommendation that everyone within those ages should still have the vaccine, even if they are considering falling pregnant. And those that are currently pregnant should also be offered the vaccine. The current policy, I believe, is that from 14 weeks, you're allowed to receive the vaccine, and we should offer it to pregnant women from the gestation of 14 weeks. However, that's going to soon be updated. I've recently heard and waiting for confirmation that it will probably be updated that anybody at any gestation in pregnancy may be offered the COVID vaccine. Pregnant women are not at increased risk of infection with COVID, but we do know that they are at increased risk of adverse outcomes from COVID and COVID pneumonia. I've myself, unfortunately, been in this scenario where we've had to perform a cesarean section on an intubated woman who had COVID pneumonia. And that's certainly not something that is a good thing for the mother's risk, but it's also certainly not something that's good for the baby's risk of having a good outcome. With regards to fertility, so this is something that seems to have come up a lot, and I think that it's a very important subject, but it's also a subject that's close to home for a lot of people, and it carries a lot of emotional feelings around fertility and fertility treatment, etc. Again, the South African Society of Obstetrics and Gynecology does not say that there's any contraindication for taking the COVID vaccine on one's fertility. They even say that you can continue to get your COVID vaccines if you're on fertility treatment, certain fertility treatments that are available in the public or the private sector. And so, again, while what the vaccine is doing is it's specifically looking at targeting the immune system. It's targeting the body's immune response to a future viral infection. And that's all it's doing. It's exposing the body to a bit of a virus, to a spike protein, a bit of the wall of a virus, to induce the body to have a memory so that when it comes into contact with the real thing, it will be protected. And this is what your body does for thousands, if not millions and millions of infections throughout your life naturally. So kids who play in dirt, who pick up stones and put them in their mouth, who get little cuts and wounds on their skin from playing, who graze their knees, etc., or who get colds and flus and chickenpox, etc., etc. All of these infections are thousands and thousands of times where your body has been exposed to potential pathogens, potential infections. The body has then learned from these exposures to be able to react in future. None of these exposures or inoculations are impacting fertility. So while the infection with COVID itself is a major risk to the outcomes of your pregnancy, there's no evidence that the COVID vaccines affect fertility negatively.
I think just to add into that, I think at the beginning when we were rolling out vaccines in South Africa, it was not recommended that pregnant women get vaccinated. But that is because vaccine trials are structured in a way that we tend to kind of test vaccines and test medicines on young, healthy people who aren't pregnant. And we need more time to collect information about how the vaccine might impact women who are pregnant because they're considered a vulnerable group. So at the beginning of the year, if you were pregnant or breastfeeding and you went to a vaccine site, they might have turned you away. But now there is more and more evidence from around the world, from specific trials looking at how the vaccines interact with pregnancy, which show that actually, the vaccine is safe for pregnant women and breastfeeding women. But we just didn't have that information at the beginning of the year, which I think was why there was, perhaps a bit of a slight fear about, if I'm pregnant, should I do this? But there's now more and more information and guidance from the Society of Obstetricians and Gynecologists that this is actually, the safest thing and the best thing to do. I wonder, I've been talking a lot and it's quite a lot of information to digest. And I wonder whether we should quickly, in the last kind of 20 minutes of the time that we have scheduled today, return to the questions and just see whether there are any kind of glaring ones that are outstanding. And also to look at the chat. Nsiki and James, I see that you guys have been messaging the chat, which is fantastic. But let's just kind of see whether there are any that remain unanswered. I see that there's a question from Melissa and Wandi at the Center for Environmental Rights. Is it correct to call the current vaccines trial vaccines? In short, no. So currently, the vaccines that we have been authorized for emergency use, but the clinical trials have concluded. Why it's not kind of like full approval yet is because regulatory authorities around the world are still kind of gathering data. But recently, I think it was a week or two ago, Pfizer was fully approved by the FDA, which is the American Drug Authority, and they're one of the leading regulatory authorities in the world about this. And what that means is that it has gone through the full regulatory process of checking that a vaccine is safe and effective. So in a clinical trial, there are various phases where data is collected to see, does the vaccine do what it says it's going to do? Is it safe? Are there side effects? And is there anything to look out for? And usually that clinical trial phase takes a very long time. It can take, upwards of 15 years to enroll enough volunteers to participate. But in the case of the COVID-19 vaccines, there were millions of people around the world who volunteered to participate in the trials. There was huge public investment of money that went into the testing of these vaccines. And there was huge coordination of scientists from around the world sharing information and sharing data. And no kind of parts of the process were skipped. There were no shortcuts taken. It was just kind of speeded up by a number of, having the resources, having the volunteers. And the regulatory authorities have done what is called a rolling review. Ordinarily, with a clinical trial, you have to collect all of the data and then submit it in one huge dossier to someone like the South African Health Products Regulatory Authority or the FDA. But in this case, data was reviewed as it was collected, which sped up the process. But the trials have concluded that these vaccines are both safe and effective. So they're not trial vaccines. If this question comes from, earlier on in the year with the Johnson & Johnson vaccine rollout, there was talk of an implementation trial. Now, that was a way for healthcare workers to get access to vaccines while the kind of final paperwork of emergency use authorization was being kind of concluded. But nonetheless, the clinical trial and all of the evidence from the Johnson & Johnson trial had already proven that the vaccines were safe and effective. And so the implementation trial was a way to kind of make sure that we were getting safe and effective vaccines to healthcare workers on the front line who needed it most. But yeah, so these are not trial vaccines. These are vaccines that are approved and have not kind of skipped any of the steps. Another safety level that all the vaccines go through is that there's batch by batch testing of the vaccines at the National Control Laboratory in Bloemfontein. So every batch that comes into South Africa or that is kind of produced in South Africa is tested at this laboratory at the University of the Free State. And that's to check that it's been stored correctly, that it's been produced correctly, that it hasn't been tampered with. So there are a number of safety checks all the way through the clinical trial and the regulatory process to make sure that the vaccines are safe. And it's safe to say that these aren't, we're not in the test phase anymore. We have enough information to say that these vaccines are good. I wonder whether should we go back to the Jamboard? Should we focus on the questions in the chat here? Let me just bring up the Jamboard.
You note the question from YouTube, Jules, that says that findings from Zoe COVID study show that Pfizer and AstraZeneca vaccines start to wear off within 6 months. How true is this, and how many trial vaccines can we expect before we get the final vaccine? So I guess that's what prompted Melissa and Wendy to talk about the trial vaccine.
I personally haven't heard of the Zoe study, but there is some debate about how long the vaccine will offer you protection. And I'm really sorry for, I don't know whether there's background noise coming in here, but there seems to be a protest in Braamfontein this morning. But from what I understand, the current data is that, the protection that you get from a vaccine lasts at least 8 months to a year, and that the protection that you get from a vaccine is longer and stronger than the protection that you get from a natural infection and recovery. So we might have all kind of heard of people who have actually gotten COVID twice, where they recovered and then a few months later, they actually got sick again, which shows us that the natural immunity that you get from recovering from COVID doesn't last much longer than 3 months, whereas the protection that you get from a vaccine lasts much longer and is typically a stronger immunity than the natural immunity that you get after recovering. I don't know the specifics about whether it's 6 months or 8 months or a year. I don't know, James, do you know any more about that, about the length of the efficacy?
Yeah, so the Zoe, I don't know if it's pronounced Zoe or ZOE COVID study, it's one that's come out of the UK, and it's looked at, so specifically it's looked at COVID infections. So it's looked at whether 4 and 6 months down the line, there's an increased, there's a reduced reduction in protection. I've phrased that terribly. It's looking at over 4 or 6 months, whether the protection given by a vaccine wanes, where it disappears over time, and whether one starts to become at risk of an infection again. And they found that there's some decrease in the numbers from the high 90s to the 80s in terms of protection from the Pfizer vaccine specifically, is what I know. And then I think they also looked at the Oxford AstraZeneca vaccine. But again, what's important to note there is that they're looking at infections. So infections can be influenced by a number of things. Can be influenced by the number of people in the community that are positive with COVID, so the number of exposures that you're having. If when you got the vaccine, there was a very low number of COVID positive people in your community, as was the case often in the beginning of the COVID vaccine rollouts, at least comparably to the COVID infection rates now. You would have been at lower risk of being infected at the time you got the jab, and 4 and 6 months down the line, there's just so much more COVID around that you were at increased risk of being infected. Other things to also consider is the variants. So we obviously know that there are new variants, Delta variant, etc., that have all of these names and that possibly have different transmissibilities, or they are differently able to spread from people to people, and some might be more infective than the earlier COVID variants, and that might be what's affected the numbers. And then lastly, and the most importantly, is again, this is just looking at infections. We not yet found any reduction in mortality and morbidity, or reduction in protection from hospitalization, which is really the key point that we're wanting to look at. So while it's, I mean, some early data that might point to the fact that we might need further top-up vaccines down the line, it's not really correct to say that the vaccines we've tried are trialed now, and we're going to have some new version of the vaccine going forward that is then going to be trialed. So COVID is probably here to stay, in the same way as the flu is here to stay. And every year, based on the prevalent flu variants, a vaccine is created that takes into consideration all of these available variants, and then gives you protection for that year. It may be that COVID protection from vaccines wanes over time, and that you do need to get new vaccines to, at the very least, prevent you from getting mild symptoms of cold and flu. But at least for the moment, there's no evidence that the protection from hospitalization and severe disease has yet fallen away. So I wouldn't rule out that we will need top-up vaccines in the future, but for the moment, it seems that these vaccines are highly effective. We know that all of the people in high care wards at the major tertiary hospitals in South Africa are those that have not had the vaccines, particularly at greatest care.
I think it's also worth saying that, I think we all want a way out of this pandemic. We want a shot in the arm that is going to make it go away forever. And we want absolutes. We want to be able to say that the vaccines are 100% effective and will prevent COVID in all cases. And as much as we want that, I think the reality of what we've got is a very good alternative. We've got a strong set of vaccines that have been tested, and the trials have been reviewed by independent scientists from around the world, so saying that they are effective and safe, and that they, as James said, will prevent you from dying or needing to be hospitalized from COVID-19. So I think we do want a way out of this virus, this pandemic, and perhaps it's worth saying then that this vaccine is the best shot that we have in combination with other strategies. So, for example, still wearing a mask in public, even if you're vaccinated, still washing hands, still trying to keep a social distance, wherever possible, keeping ventilation and windows open to keep airflow going through. So, in terms of where we are, this is the best shot that we have at kind of, getting the pandemic under control, taking pressure off the healthcare system, helping our doctors and frontline workers, returning the economy to normal. It isn't a perfect solution. It isn't a magic cure, but nonetheless, that doesn't mean that we must throw the baby out with the bathwater and kind of like give up on it altogether. Because actually, anything that you can do to prevent your risk from dying from COVID, from getting severely ill with COVID is worth taking. I think so. There are a number of questions that have been raised also about whether you can transmit the disease if you've been vaccinated. I think, as far as I understand, you are less likely to spread the disease once you've been vaccinated. And part of the reason for that is because once you're vaccinated, if you get sick with COVID, it will be a much milder version of the disease. And part of what that means, I think, James, and I hope that I'm saying this correctly, is that you have a lower viral load and you won't shed the virus as much. And when you shed the virus, that's when it's contagious. That's when the droplets might go onto a surface. That's when, when you're speaking with somebody without masks, you might share droplets. So the chances of spreading the disease once you're vaccinated are lower. It's not a complete sort of, you might still be able to spread it to somebody else, which is also why government is saying you must continue to wear a mask, continue to keep a social distance. So, we need to think of this vaccine as kind of one tool in our toolbox to fight against COVID, and a very powerful tool at that. But it is not the kind of be all and end all. And I think, as much as we want to kind of an absolute in this situation, we don't have them yet.
I'll touch on that as well, Julia. Yeah, so it's a very important question, and it's certainly something that's being looked at a lot in public health circles, because it's important to think, can we use this vaccine to really prevent transmission as well as preventing severe infections and reducing the burden on hospitals. And it does seem that there is some data that, for example, Public Health England did this large trial of over 300,000 households where they looked at people in a household, some of whom had been vaccinated and some of whom had not been vaccinated. And they looked at the risk of people becoming infected with COVID-19 virus. And they found that even a single dose of the Pfizer or the AstraZeneca vaccine, so that's not the full dose, had something between 40 to 60% reduction in transmission rate. So that's not 100%. That doesn't mean that if you've had the COVID-19 vaccine, you can't get infected, and it doesn't mean that you can't then transmit the virus on. But it does seem that there is a reduction in transmissibility, and that may be because of reduced viral load or because of some protection in getting infected in the first place.
So kind of on that, there's a question from one of the Kyla Hazel saying, I've had a lot of people suspicious about the vaccine questions asking, what's in it for you? There's distrust when it comes to government, the West, and pharmaceuticals. How can one respond to these sort of fears? And I want to link this to the conversation about kind of like why to get vaccinated. And I think that these kind of, the motivations for getting vaccinated have been communicated by government, have been communicated by pharmaceuticals, but they're valid nonetheless, is that getting vaccinated is the best thing that we have right now to protect yourself, but also to protect the people around you from getting severely ill from COVID-19. There was talk earlier in the year that we want to achieve herd immunity or population immunity. The scientists are saying that it's unlikely that we'll achieve this complete herd immunity where we reach enough people who have been vaccinated so that even the people in our communities who are vulnerable and can't be vaccinated are protected because the virus can't spread anymore. That is a hypothetical situation, but as James has said, like within households where there are people who have been vaccinated and people who haven't, there is a kind of, a reduced risk of spreading the illness. So you can think of this vaccine as something that you can do for yourself to protect yourself, something to protect the people around you, some of whom might be vulnerable, some of people who might not be able to vaccinate because of, rare autoimmune problems. Also, I guess something to do, for the community as a whole, to take pressure off the healthcare system. I'm really going back on that point, but there are so many people who have been turned away from hospitals because the beds are full with COVID patients, and people who have tuberculosis, HIV, cancer haven't been able to get the treatment that they've needed over the past couple of years. And so I think that this is something that, based on your own informed decision, based on your understanding of the risks, this is a decision that you can take to protect yourself, to protect others, to help your community. In terms of whether, there was a question on the chat earlier, and I'm sorry, I'm just so conscious of the time, and there's so many great questions here. There was a question about whether it is compulsory to vaccinate and whether you can be dismissed or whether you will, not be able to get work in future if you don't vaccinate. And at Section 27, we've done some research about this. Currently, it is not universally compulsory to vaccinate against COVID-19. In other words, the only places where it is compulsory to get vaccinated are in certain employment situations where the Department of Labor and Employment has given a set of directions saying that companies can make vaccination compulsory for their employees. For at-risk employees, they have to do a risk assessment and they have to come up with a plan about how to accommodate people who can't get vaccinated because they have medical reasons for saying no. And the directions do say that you can say no to a vaccine on constitutional grounds. So that could be the right to bodily integrity, the right to religious freedom or freedom of belief. Now, like from Section 27's perspective, what we're saying is that vaccines are not compulsory currently. There are a number of vaccines in South Africa which are compulsory. The immunizations that we give to children are compulsory so that we don't have outbreaks in schools. But currently, COVID vaccines are not compulsory across the board. It's just in these certain companies who have developed the risk assessments and plans. But we're still saying that mass vaccination is the best shot that we have of keeping ourselves safe and protecting the people around us. So while it's not compulsory, and currently, we haven't heard of any stories of people getting fired for not being vaccinated, We haven't heard any stories of people being, like discriminated against or perhaps evicted for not being vaccinated. We haven't heard stories of that happening yet. Nonetheless, despite the fact that it's not compulsory, it's still something that we really encourage everybody to go out and do. Everybody over the age of 18 is now eligible to get vaccinated in South Africa, whether you're a South African citizen or a migrant. They are developing systems for people who don't have documentation, such as an ID number or a passport number or a refugee number, to get access to vaccines, because this pandemic has really shown us that our actions and our health impacts the health of the people around us in unexpected and unintentional ways. And if there are actions that we can take as individuals, and also I would argue as activists, most of the people on this call are community-based activists, people who work in the human rights sector. If there are actions that we can take as active citizens to not only protect ourselves, but to limit the risk for other people and to contribute to a kind of broader effort of helping the healthcare system and helping the economy, I would encourage you all to go out and do so based on your own medical risk and your own medical history. I see that there are 2 minutes left and we haven't gone back to the questions. James, do you want to jump in here?
Yeah, I'll speedily just answer something that I didn't want to get missed. There was somebody early on who was asking about getting the vaccine if they're diabetic. I would highly recommend getting the COVID vaccine if you're diabetic, especially if you're a diabetic, just because of what we know about the risk of severe COVID in those with diabetes, whether it's under control or not. That's more than, I think, 45% of those in a recent study at Cape Town who were diabetics who tested positive for COVID ended up being hospitalized. And there's over 3 times higher risk of death in diabetics. It seems the immune effect is very severe. So I would really recommend you considering getting the COVID vaccine if you are a diabetic. And then I think that question that's you responded to around the what's in it for you and the distrust of government and the West and pharmaceuticals is a fantastic question. And I think it's a narrative that we need to reclaim. I think PHM is really focused on a lot of this work, and I know Section 27 and others as well, is that we need to reclaim the narrative around that because we distrust these organizations, that therefore we distrust the vaccine. What we really should be pushing for is why are there certain intellectual property restrictions on the vaccine? Why the vaccine has such high costs for developing countries? Why is the vaccine not more widely available for people in lower and middle income countries? Access issues, transport issues, all of these things around vaccine equity is really where we should be pushing, that people are not, the incentives to get the vaccine out into rural areas and lower income areas are not as strong as they are to get them into the business centers simply because of these misaligned perceptions. And in terms of reclaiming that narrative, I think that's really the basis for a lot of activism work that can be done to push pharmaceutical industries to get rid of patents, to waive intellectual property rights, and to support lower income countries who don't have access to huge financial capacity to buy up millions and millions of vaccines, to ensure that they do have access as well, and that our interests are also respected.
And I think there, sort of these vaccines have been tested, and the evidence from the trials has been tested by independent peer reviews, which, these are people who don't come from the pharmaceutical industry, but who are scientists independent of the people who did the trial and who still verified that these vaccines are safe and effective. And if we can trust that information from scientists, and South Africa has some excellent scientists who are respected around the world, if we can go from a position of trust in the safety and the efficacy of the vaccines, then the next question comes into how we can champion access to vaccines. And in South Africa, we have actually secured enough supply of the vaccines to vaccinate the majority of our adult population. The question then becomes about, getting the demand for vaccines up and making sure that access to vaccines is done in an equal and dignified fashion. We've already got sort of more middle class, urban areas. The vaccine rollout in those areas has been much, much, much faster than areas that are kind of more rural, or as James said, the kind of like low income areas. And then, the question for the people on this call is what we can do to put pressure on government to make sure that rollout is not just kind of, reaching the people who are easy to reach, but how do we reach people in rural areas, in low income areas? How do we address their concerns? How do we address the hesitancy and kind of get home the message that vaccines are the best shot that we have right now? Now I know that we're kind of like already over time now. It's 2 minutes past 12, and it's been a lot of information to digest. I'd really like to encourage you that if you feel like your question hasn't been answered in the session today, please reach out to us and we will try and kind of, send you materials and send you information about how to best answer those questions. But I guess to thank you all for your engagement, for being here on a Friday, for the really, really, really rich questions that you've shared with us and the level of kind of interest that you've brought. And a huge thank you to Dr. James Van Duuren, who has taken time off from his day off when he's not on call to come and, sort of come and speak to us today. And just to say that we will share all of the resources that we've used today, whether that's the manual, whether that's the graphics that we've used, whether that's the kind of links that have been shared on the chat. Those will be circulated to everybody who registered. And there have been questions coming in on the chat and on the WhatsApp line about whether we can run another session like this in future. We will look into doing that based on our capacity, but we're really excited that there's a hunger for this. And also that we will share the YouTube link with people in case they couldn't watch it today, but would still like to receive the information. But I think let's close it there, but just thank you all for your time. Thank you for your engagement. And we look forward to taking this conversation forward. The science does the science changes. We will update our materials and update our information. And we just thank you for your interest and for your time today. And hopefully, if you need help registering for a vaccine, reach out to us. We can try and help you. And just to encourage you all to stay safe, because it's still a very real threat out there. So thank you very much, everybody.
Thank you, Julia. Thank you, James. Thanks, everybody, for attending today.
Thanks, everyone. Thanks, Section 27.
Thank you, colleagues. Thank you so much. That was lovely.
Yeah, they all left.
You see that? Over was lovely.
Can you keep quiet? I can't even say bye or anything, but I am out now. I hope so.